as I say, welcome back. It's good to have you with us. And we're appreciative of those that are listening in live. And if you're not listening in live, but you're listening to this later, still welcome. Good to have you here. We've had a pretty good, we've had a couple of really good conversations this morning. We had Coach Mike Petrino, who's the assistant coach for the Lady Broncos, and he helped us think through how to put together a team. And so that's kind of what we're trying to do, is a little team building and maybe some suggestions on who might be on their team. And so, we're going to try to stuff an awful lot into an hour here because there is stuff to talk about. So the folks we have with us, we're covering a number of different things. And if you would like to be at home, and the statistics show that 90% of us over age 50 are planning to live at home. And I guess just quietly go at age 95 and have just incredible health up to that point. And we just died. And I'm all for that. I love that. I just don't know how realistic it is. So we have with us, we're going to eat, we've got drugs, we're going to fall or maybe not fall, and some more drugs. I love this. This is a great conversation. So we have with us Kevin Crumley from Mountain Care Pharmacy. Kevin was on a podcast with me. I learned lots of great stuff about med management that everybody thinks they can do.
Right.
I didn't overstate it, right?
No,
everybody thinks they can do it. And the reality is
like nobody can do it.
Okay. All right. We're going to come. We've got out of Simple Bites meals. And this, of course, intrigues me because it's food.
Absolutely.
And that was something that my mom struggled with. She was never a great cook. She took care of his kids. I got that. But then when she got older and was alone, it's just hard.
Right. And, you can be a great cook and still want to cook, but there's days that you don't want to cook at all. So it's important to keep those nutrients.
Yeah. And we have Mike Rice with us, Fit and Fall Proof, and hopefully helping us, one, not to fall. And maybe if we do, maybe there's a better way than others to fall.
There is a better way if you have to fall. So
such as not doing the face plant.
Yeah, don't do the face or the cartoon of the banana peel man, just
oh my gosh. Mom, that was something that helped us to move forward. Is she fell in the backyard and there was a little bit of a hill and rolled down and got ensconced between the fence and she couldn't get out. And we had a much better conversation about doing something different after that. And we have Jenny Lingle with Comagine. Isn't that a song by John Lennon?
It could be. The Comagine I work for is a nonprofit that works to improve health outcomes, and in Idaho specifically, health outcomes of Medicare beneficiaries.
Oh, very good. Oh, geez. All right. So I think to get everything in, we're just going to talk all at once. All right. And just start. And so if it's okay, again, this is very informal. This is going to be somewhat random. But we've talked before, Kevin and I, about managing medications, and is often kind of the beginning of that slippery slope that gets us into more managed care.
Correct. Yeah, it's actually the number one leading cause for going into, whether it's the hospital system or a long-term care situation or even into hospice. Medication mismanagement is the leading cause of going into that. And then, like, once you get into those systems or once you get into those, places, it's very unlikely that you'll get back out, back to an independent kind of situation.
Okay, we're going to talk about some options in just a minute. But talk to me. Okay, my folks are both gone now, but when mom was home, how would I check on her medication management? What are some
Gosh.
things to look for?
A multitude of different things. So first and foremost is looking at the last time that the medication was filled, counting out medications that should be, a daily kind of situation, making sure that they're actually taking those medications. It's very difficult when you've got 30 different pill bottles, right? And that's an exaggeration or overstatement, but when you've got so many different pill bottles to try and keep track of everything that's going on and making sure that you're getting this medication or that medication. And that's kind of the first and foremost is, and most of the calls that we get are, I don't even know where to start. I don't know. I can't tell if mom's taking this or dad's taking this.
And if you ask them,
they
say,
of course they took it. Of course I took it. I know exactly what I'm doing. I know my medications. I've been on this for, 5 or 10 years or whatever it is. I know what medications I'm supposed to be taking. But I mean, like we talked about in the podcast, it takes one missed dose of even a blood pressure medication. And all of a sudden you have a fall and all of a sudden, you're into the system and, staying independent is your goal. You have to manage those medications as best as possible.
So Jenny, how does this play across here? What it is that you do?
Yeah, so very similar to med management, keeping you out of the hospital system. A few preventative care steps can also keep you out of the hospital system. So for example, pneumonia is one of the main causes that elderly people are admitted to the hospital.
Are you kidding me? I didn't know that.
Yeah. So really, really common. There is a pneumonia vaccine that is good for up to 5 years. And actually there's a new one that is one and done. So if you get the new PCV20 pneumonia vaccine, that's it. You never need to get another pneumonia vaccine again.
Oh.
And it's highly effective in preventing severe illness related to a pneumonia infection.
Well, I know that pneumonia with the COVID thing was
right.
particularly devastating.
Correct. So this time of year, we call it kind of the kickoff to the respiratory sickness season. So October is Influenza Awareness Month. So really encouraging, if you want to stay out of the hospital system and be able to be independent at home, to get those preventative vaccines. So influenza vaccine for people 65 and older, there's a high dose vaccine that's recommended.
So I just want you to know, I can't take that yet. I'm just throwing it out there.
If you can't get the high dose, get the normal flu vaccine. And then, of course, there's a new COVID booster that covers the Omicron variant. It's referred to as bivalent. Yes. So that is the only booster available, highly recommended. And then if it's been more than a year since your last pneumonia vaccine, you're probably due for this new one, and then you're done for life for pneumonia. And those 3 vaccines alone will go a long ways in keeping you healthy at home during the respiratory season. And then there's some chronic disease management people can do. And I can talk about that having a really good primary care provider and a pharmacist on your team. And I always say primary care doctors can quarterback your team, makes it easier to manage those chronic diseases and keep you at home versus having to go into a long-term setting.
Yeah. And then that team is going to prescribe this and follow it.
Yep. So a primary care doctor or sometime internal medicine will be connected with your pharmacist, and they'll be working together to help manage your chronic illnesses, to make sure you're getting those yearly recommended vaccines. And again, a good primary care doctor is like a good quarterback, and they're passing off to other key members on the team, like a pharmacist.
Although, just for someone who's maybe not 65, it's hard to sit down with the primary care doctor. They have a system where they pop in and say, hey, tell a joke, and then walk out. And then, so maybe we should be a little more intentional about seeing the doctor.
Yeah. So, kind of the main things you want to be looking for is asking, have my kidneys been screened? Chronic kidney disease affects over 50 million people 65 and above, and most people aren't even aware of it. And if you're screened for it and it gets caught early, it's very easy to manage and keep it from progressing. So you want to be asked, ask your primary care doctor. That's a good one. Have you screened for my kidneys, both a blood test and a urine test?
Right.
That's a great thing to ask. And then diabetes and hypertension are really the other two most common ones. Again, very treatable with medication that can be managed.
If they take the medication.
Correct. So I would recommend minimum a yearly check-in with your primary care doctor. But really, if you have any chronic illnesses at all that are being managed, you want to get yourself set up on a 3 to 6 month cycle of going in. So you go in and see them, you schedule on your way out, and also get to know your provider's front desk staff, the nurse or the medical assistant. They're also an integral part of that care team.
And it won't help to go do that with the doc if you're not managing the meds.
Correct. That's the follow-up to it. So it's all important, all connected. And you want to find a pharmacist, a provider that all will work together and keep you in the loop and making sure you're on track.
So pulling together a team, sometimes I'm a team player, right? When they pull this team together, I'm always looking for the coach. Who's the coach? Who can coach them? Have you been into your primary care, team? Have you talked to them? When was the last time? Are you keeping up on your meds? Is there someone we should have on our team that can do that?
It's a great question. So some healthcare providers and pharmacies will have a caseworker that will check in. So some offices provide that.
For instance, like we as a staff, our pharmacy have dedicated pharmacy technicians for given patients. And their real mentality is, checking in with the patient on a monthly basis, right? Asking questions like, have you gone to their doctor? Has your regimen changed? Are you feeling different about how your meds are treated or reacting? All those kinds of things. Additionally to that, they understand and they know, your billing cycle, and they know all of those questions and that kind of thing. And oftentimes they end up being so integral in the person's life that they understand, pets and family members and all.
I wasn't even going to go there, but I can imagine that phone call lasting an hour and a half.
Oh, it does. Yeah.
It's like a 15-minute.
Yeah.
I'm just checking in. All of a sudden, oh, and you have a new great granddaughter.
Yep.
No,
it's
I know. I know how my mom was.
Well, and we oftentimes run into that same kind of thing, right? Where you go into a provider and you get that 5-minute spiel of stuff, and you don't get that, in depth of care. And some of that's just the community that we're in, as far as what we have per capita doctor wise and that kind of thing. They only have so much time to get to each patient. So we try and create that level of care and comfort, so they can feel like they can say stuff that they might not say to their provider, which is another one of those things. Is oftentimes we're afraid as individuals to say, I've been feeling this way, or this medication makes me feel really weird. And it's an okay thing to say.
Yeah, I can see the situation where they go, yeah, I'm feeling better. Oh, you're finally taking the medication.
That happens fairly frequently too.
It's not funny. Okay, so now if we're visiting with our primary care and we're doing the lipid panel and all that stuff, one of the ones that I hear from my urologist, well, you're a little dehydrated. And I go, yeah, my appointment was 8 o'clock in the morning. I don't spend the whole night drinking water. Well, that's true too. But I'm sure not just fluids, but nutrition becomes an issue. So if we, my mom, this is my mom. Well, I had to go shopping, and she didn't like to go shopping. And I bought the groceries, and then I had to get the groceries out to the car, and then I had to get them home and up the 12 concrete steps into the kitchen, and then I had to put them away. And then I had to figure out what to eat, and then I had to do something with the leftovers.
Right. People just don't realize how much nutrition plays into the whole part of things. including medication, to be able to take your medicine correctly on a full stomach, keeping track with the provider assaying, how much did you eat? Well, you may think you may have eaten quite a bit, but in actuality, you took a bite of a muffin. There's a big difference in there for an actual nutritious meal. And it's important, even though you're aging, you aren't as hungry, but your body still requires the same amount of nutrition. So it's important that you maintain that, because it really is kind of the glue that holds everything else together. And so, you can be lightheaded and fall incorrectly. You cannot take your medicine correctly. Going out to the store, you may fall on the ice. Lugging up the bags and you twist your arm. There's so many different things that can happen to you. So it's important to be able to have meals, nutritious meals that are easy access, easy to reheat, and people can maintain and look and go, I see 4 of those containers. Okay, you had 4 meals, something like that.
It's the same thing. You could walk in and the kids can go, Mom, you're not eating. Well, how do you know?
Right.
Well, because
Visible verification.
right here.
Right. Because a bite of a muffin doesn't cut it. That's not enough nutrition. And so that will just start deteriorating you if you're not eating correctly.
Well, you also have medications that you should take on an empty stomach, and medications you shouldn't take on an empty stomach, and medications you should not drink orange juice or apple juice or grapefruit juice or milk. So all of this gets connected somehow. Okay, so help us help Mom here. What is it that you guys
What we do?
Let's do.
Well, we really provide meals for anyone who wants to eat and that doesn't want to go to the store, doesn't want to prepare it, doesn't want to cook it, doesn't want to clean it up. It's a great alternative, nutritious meal that tastes really great to keep in your freezer and be able to pull when you want it.
Now, are these cooked already and they just need to heat it?
Just need to reheat
This isn't
these.
like, here's all the ingredients and now
Right.
you have to cook this.
It's already done for you. And there's no subscription, there's no commitments. You just order them as you want them. And we've got all different kinds that you can try and be able to see if this is something that just maybe fills a void. Maybe your daughter prepares meals for you 3 times a week. This could fill in for the other 4. For busy professionals, you can have at the office and be able to pull it from the refrigerator. And yeah,
That you could have that in the freezer over there.
yeah. That way you guys are good to go. So it's important that people realize my primary health physician told me the first 50 years you live to eat, the last 50 years you're eating to live. And so he said it's very important that you have to pay close attention on all the details if you want to live a long, healthy life.
Okay, so you haven't said it yet, so I'll ask it specifically. Somebody figures all this out. You have menus set up, the nutritional value.
That would be me. Yeah.
You got that all put together, right?
We do. And we provide every meal with full nutritionals. We also will give it to you to give to your provider if you want them to look at it, to circle, things that maybe you need to stay on the more low sodium, or you don't like mushrooms. We provide all that information for you up front. And then that way you aren't stuck with stuff you don't like.
So I could see this being an excellent conversation between, say, daughter and dad, or daughter and mom. You notice how I say daughter. Because sons, I guess, just don't do this stuff. Oh, I knew that.
So it's like, I don't know. Yeah, it's a great conversation to have because and with the weather changing, snowstorms coming up, what if you can't get over to mom's house? What if, something comes up, or what if mom's extra hungry at 11:30 at night? These are just great things to have so that they can have a nutritious meal. They don't have to prepare it. They don't have to clean up after it, and they don't have to eat it for a week because it's a single serving.
So is this built on, one meal a day? Not that they're eating just one meal a day, but the service would be one good nutritional meal, hot meal. Then we're not so worried about them.
You can. I mean, we also offer breakfast items. We offer fresh salads and snacks. I mean, we have a whole gamut.
Choco Krispies for breakfast.
Yeah. We're, I'm an Idaho-based company. I'm local. I'm woman-owned. I built this from nothing, and we provide a lot of great services. You can come pick them up at our shop, or we will come to you and we help you put it away. I mean, we really do take care of all of our clients.
Ooh, that is awesome. So, Mike, to add to this suite here is it would be good for folks to learn how to take care of themselves physically.
Mhm.
And that's what you do.
That's what I do. I teach volunteers how to teach others exercises to prevent falls. The ability, as you know, to just stand, we take it for granted for some, and then when it goes, the person has a situation because, we stand, go to the fridge, go to the restroom. All of a sudden, you can't do that. And it builds a downward spiral. Grandma falls. She doesn't want to get up and walk anymore. She doesn't want to go participate in things. And down we go. So we try to head that off, keep the line of decline as slow as we can.
Yeah, get rid of the slope.
Get rid of the slope.
Try to bring that up a little bit. So it seems to me that one of the concerns that people have is, well, I can't do calisthenics. I can't do exercises. I just know that's parked in the brain.
It is that way. And I was the PE major that barely passed PE. So, walking up the steps there.
4.0 otherwise. But
Otherwise, it was the
oh, sure.
PE.
But that's just it. We keep it fun. We say, try to say movement. They still say, oh, I'm going to exercise class, but I'm going to fit and fall proof. We don't really try to play renaming it, but that's kind of how it works. We give them silly names. Every group has their own names, for goalpost. Some people call it BSU, not this year. And we're like, hey, but they're doing it,
Yeah.
And the same way with standing. And the big part of our group that's the group. It's almost second family at times. Some of the groups, someone went to the hospital, had to turn the visitors away because everyone wanted to go see them.
To pay attention.
Yeah. So, between the social and the physical, it's been really great to see people, even before I started, are still going.
Oh, right.
And they're still walking, driving, living alone. And
So walk us through kind of a series. What does this look like? The walking part of it. There's the up and down part of this.
sure. And everybody participant has a chair for safety. You can remain seated and follow along if it's just one of those days, which is fine, but we encourage as much standing and make contact with the chair. Sometimes we get interns because we'll work on the lower leg compartments as one Karate Kid stand. We'll call it that. Everyone knows what that is. But you don't practice it. You're not just going to walk along all of a sudden. But in a group, being silly.
I will call you when I see that out on the street.
But when you're in another group and kind of being silly, half serious, serious in intent, but silly in how you execute it, it's worked out really well. And you get interns will call me back by Friday going, Monday they're going, this is not even a warm up. What? And we're just like, just do it. And then Friday's going, my lower leg is like, yeah, who works on their lower leg? I mean, you play soccer, you do this. So, yeah, okay. It was good to see some lights go on.
Yeah.
And especially, hip strength. Again, being able to stand, we do a lot of faux stands. Sometimes it's silly. You flap like a bird and bend your knees, but those knee bends, keeping the ability to do that gives the ability to be able to stand or recover if sidewalk is going to be it's going to be up and all of a sudden you hit that, you realize if you could just drop your hips and bring the other knee up, you don't fall.
You'll be okay. But if you don't have that flexibility or that strength.
Yeah. It's kind of like the, Star Trek has their prime directive. Every profession has a prime directive. Ours in PE and movement is if you don't use it, you lose it, or your specificity, your body adapts to very specifically what you do. And if you're sitting like this, 40 years of desk jockey, all of a sudden falls, then they come to us like, I just sat, I never did any of this stuff. And then they realize when we can build the confidence that you can, it comes back, your body wants to move. It, needs to move, and it wants to, and it will remember how to, when you stand up, how to catch yourself forward, catch yourself backwards. And then we just kind of practice it with sometimes, we're always laughing and kind of being silly, but, again, the ability to remember to bring that knee up and set, and then you go, oh, I didn't fall. And it's nice getting the phone calls, it's kind of, well, I almost lost it on the stairs, but I didn't because you told us drop your hip.
Ah, very good.
So,
As with other things, right? They could do this on their own at home, right?
yeah,
They could.
they can.
The actuality is they don't, or they don't know what they should be doing. So,
Mhm.
so the help here, or the cheat, is they have someone who can coach them through this.
Yes, there's videos available through Health and Welfare,
Ah, very good.
and it's volunteer master trainers leading demo classes, pretty much the same. And we just vary it up. Again, the live is more for fun because you don't want to see the same face on the
Right,
video.
yeah.
Happened during COVID. I'm like, I'll get on main stream, and they're like, no, we want to see our friends. So they go to the park. They met in people's garages, keeping themselves active.
Yeah.
And they probably, they played some gin rummy. I assume cards.
I would assume, yeah.
At this gin,
Have them stand up to do it.
but yeah.
Yeah.
it's-
And what if we hid the remote?
We thought about that. We could tie a drone onto it.
Oh, there you
It
go.
goes to
Put it-
random places.
Put it on, is it the Roomba, put it on and have it go around the house, you're looking for, I want to do that with my dog. So the kids could check in on mom if she's trying to do this at home. They could, look at the videos and check this out.
Mhm.
But being with the group is just a lot more fun.
Yeah,
Very
it is.
good. Very good.
If they're doing it, they can build themselves up to be confident to go and meet a group.
Oh, yeah. Oh, excellent. Excellent. Do you do a lot of walking in this? Is walking a big thing? You just
It
show them
depends.
how to do it.
They follow along what we're doing. It depends on the room of the site a lot of times, but we like them to have contact with the chair just in case, or contact with a wall. So we'll march around the chairs and we'll do simulated things like high knee marches, or we'll just pick one side and you tap your knee. And while it, again, to a 16-year-old would look at you like that's not exercise, but 80-year-old Mrs. Jones getting back
Yeah.
to it, that is quite a bit. And you always practice one-legged standing of some kind
Yeah.
and shuffling, side to side, because also the inner ear, the sands of the inner ear might be getting, and if they do this and they seem loopy, we're like, call your doc, call your PT.
Something to check on. Yeah. So if we have Mrs. Jones, who has not been doing this,
Mhm.
come anyway?
Yeah.
Because we're gonna start.
Got to start somewhere. We'll start where you are. Again, we have triathletes who just run me into the ground, and we have people just starting who can, 3 sit to stands was all they have, and then I'll come back and visit the site, 6 months later, and look at me. Keeping up with
I
it.
love it. I love it. I love it. I love it. So if we're talking to the kids, which we are, okay. Don't tell them that, but we're talking to the kids here a little bit. What should we be talking to, mom or dad about this?
We find it's the same as the commercial gyms have. Start with these great intentions. The first of the year, the gym's crowded, and then all of a sudden, by March, it's the same group again. I said, you probably have to do it with them. A buddy, that's why personal trainers are in business. It's not so much that what they know is that they just do it with you. and you got to go report to somebody, or you get this phone call.
Accountability.
"Where are you?"
Yeah, accountability.
So that's some of it too, with volunteers. They're just like, well, I can't teach. Yeah, you can. I can. I have a master's degree in the darn thing. If I can, you can. My IQ is not way up here. I just wanted to do something, and you can. And we could show them, the basics and how to do things.
We're not sitting here trying to get them ready to go do a 50-mile backpack or anything. This is just to get through the day.
Yeah.
And do it in a way that they're, they have that core strength and they have a little coordination and some flexibility. Sweet. I love it. Well, I'll see you in a couple of years. So give us, if we're going to re-emphasize our med management, what are some of the options? What are we looking at?
I mean, again, I hate to just continue to say, going back to the podcast, but it's not necessarily just about, working with me or working with, whatever pharmacy it is. It's finding those people on your team, those people that are going to be in your corner, those people that are, advocates for you, to help manage your medications. I mean, we have a specific way that we like to package the medications, but there's other people that, are capable of continuing to utilize vials. It's
Where
how
are you at?
we're probably somewhere in the middle range as far as the level of, technology is concerned. I mean, you can get those, I'm sure you guys have all seen them, like the really intricate, pill machines that sit on your countertops, right?
I want to get
that sit there
for
and
my-
eat for you.
I want to get one for the dog
Do
to
it.
keep her engaged, right? She's going to eat today. She's got, anyhow.
Exactly. But I mean, I think at the end of the day, all this kind of stuff goes back to, having that accountability, having somebody on your team or somebody in your corner that is fighting for you, that is a good, asset for you, to continue to manage those things. If you, I just keep going back to it. If you miss certain medications or even single doses of medications, I mean, the trajectory of downfall is significant, and it only takes a couple of missed doses to really get to that point.
So we talked, I know, but bring that back and talk about how you can package that.
Yeah. So we have, we call them blister cards, but they're basically just week worth of medication in one single card, and it's got Monday through Sunday, and it's got 4 different times of the day, which are kind of the most routine times that you're taking medications: morning, noon, evening, and bedtime. And it's super simple and easy. I mean, everything's super visual. So if you popped out Monday morning worth of medications, you can sit there and see that the Monday morning of the medications get popped out. Our specific service is free for the packaging and free for the delivery. We don't charge anything extra, other than, just your normal kind of copays that you would be getting paid or charged for at any other kind of pharmacy.
Yeah, we're going to talk Medicare in a minute about that.
Yeah. But I mean, as far as the medication is concerned, yeah, I just go back to find that person that's going to be key to your success.
So it's, for all of this, is find what works. But I think the worry that I have is people don't know what that looks like. And so without the help, they're looking and they go, I don't know if this is the thing that works. And so sometimes we have to help them or coach them up to go, yes, this is what's working, for these meals per week, seem to be doing a good job. We can tell if you're taking your medications, and we can probably tell if they're doing exercises. I mean, I had the gentleman next to me at church on Sunday, a big guy, and he needed some help to stand up. Fortunately, he had his walker. That was a good thing, right? But I can tell he's not doing a lot of exercising to help himself to do that, which is, it would be nice if they did. So talk to me about how the med management and, we got Medicare, we got Advantage plans and all that. does that cover what he's talking about?
Yeah, so Medicare can get complicated. I would say, first of all, check in with your Medicare plan each year. Don't just assume that you're on the best plan or that your parent or loved one is on the best plan. There are state-based Medicare navigators in every state. So you can just go online, Google that, and they are no charge to the people. So if you're confused, you want an unbiased person to talk it through, start there. I would say always check in on that plan every year. If you do have a team that's already established, you want to make sure that whatever Medicare plan you're on is going to allow you to stay with that team. Some Medicare Advantage plans will kind of tell you where you can go and where you can't. Not all. So it's a good thing to check. I would say a lot of people, not just seniors, but everyone missed some crucial appointments during COVID. Doctors' offices, pharmacies, they all had different protocols set up during COVID. So I would say now's a good time to stop and just check in. When was the last time we went and saw our primary care doctor? And the first thing is just making that appointment and going in. Again, you want to ask about your seasonal vaccines to prevent those respiratory illnesses that we talked about, flu, COVID, and the new pneumonia vaccine if they have it. Sometimes doctors' offices will say, oh, we don't carry that here. You have to go to a pharmacy to get it. And that can feel really frustrating for anyone, particularly if someone has some mobility issues. And it's a big ask to get in and out of a car and to go different places. So that's why a good pharmacy is really becoming ever more important, because we're seeing more and more vaccines given at pharmacies, even than provider offices. So that can happen with Medicare, that they won't necessarily reimburse at a doctor's office for those vaccines, but they will at a pharmacy. So find your good pharmacy, and there are pharmacies that will come out and do remote vaccines as well.
Very good.
So you can ask about that. There are also some providers that will do home visits. So you can ask about that. If yourself or your loved one has a lot of mobility issues, that's a good thing to ask about. And then also when you get reconnected with that primary care provider, asking about have my kidneys been screened with both a blood test and a urine test? And then my diabetes, do I have diabetes? If I have it, what's my hemoglobin A1C? And that's a simple blood test that tells you what your average blood sugar has been over the past 3 months. Hypertension is the other really common one. And asking for a care plan. Can we get a care plan set up? And a care plan is often something that can be printed out and referred back to. So once that person goes home, it can be really hard to remember all the things the doctor said. Sometimes the jargon can be difficult to understand. So asking for a printed out care plan. And is there a way for me to check back in before my next appointment? So sometimes a doctor will say, oh yeah, call and talk to my nurse, or we'd love for you to track your blood pressure at home and then let us know what it's been. So kind of asking about those in-between touch points. So again, reestablishing care if some of those important appointments got canceled during COVID. Finding a really good pharmacist, close by pharmacy, close by your home, or that can come to your home for those vaccines that may not be available with Medicare in your doctor's office. And then the diet's huge for some of these chronic diseases we're talking about. Chronic kidney disease, diabetes, and hypertension, all very much affected by diet. That goes hand in hand with the medication management. And then again, staying out of the hospital, the falls are huge with.
Yeah. Now, so again, we're getting better. We had a generation where that was overwhelming. That was just too much. They just would not be good, and we're not. Many of them were not good with that. We're getting better. I noticed that my older clients are getting much more tech savvy, and it's been a bit coming for that, but they're much better with the technology. But this is clearly, it seems to me, a place where one of the kids can step in and help maneuver this.
Absolutely.
So this one, it seems to me, is with the primary caregiver. That would be a great appointment to have, your son or daughter in tow. For my mom, she had 2 granddaughters that lived real close, and they went to her appointments with her. But having that, third person there to listen, and were good at taking notes, and then they could follow up at home. So this would be a great place to have a spot on the team that can do that.
Absolutely. If there's a family member that can go along, take notes, ask some specific questions. And sometimes it's hard to remember in the moment to ask, like, can I check in by phone before my next appointment? Who can I do that with? So it's so nice to have an extra set of ears at that appointment.
Absolutely. Absolutely. And I think that's all the way around.
Absolutely. Yeah.
If we had that person. Now, the two granddaughters were pretty good at coordinating. So, you know, the one did this and the one did this, and, you know, and kept track, and they communicated very well. And they were available to us kids that weren't right there. We could always find out how things were going because they, you know, they would do that. And it just dawned on me, you could do that through technology too. You could say, hey, I was with mom at the eye appointment. Here's what happened today, and here's what's going on. Then you can keep track of that. That would be. And that's something also, though, that I think we forget is the technology that's available. So that we got Mama Portal during the COVID. It's the Apple FaceTime sort of a thing. Oh my gosh, we get calls all the time, just because she could, and she got to the point where she couldn't hold the phone. You know, that was hard to hold it up here. And so when the portal was sitting there, we just get random calls at random times.
Well, and that's such a good point. I think one of the best things that came out of COVID was the ability to do telehealth. And
Yes.
that moved, COVID pushed that forward. It would have taken probably another 20 years to get where we're at now. So that's another thing, that if there's a mobility issue, getting something set up to where your loved one can do some telehealth visits. And maybe you go in for that first appointment to get all the blood work done. And then the next couple appointments every 3 months, you can do a telehealth appointment.
Yeah.
So checking in with a provider about that. You can't do all of your appointments that way if blood.
Don't understand.
But it's a great option and something we can be thankful for COVID, for kind of pushing that forward and making that more available.
Well, one of the things, as far as being a child of a person, say in assisted living, or even at home, maybe is a better one, is the ability to see how they're doing.
Mhm.
Right? They say, well, I'm doing fine. And you're looking at them and there's a mess and the makeup's all over this way. You're like, okay, yeah, then don't tell mom, she's passed away. So it will be a while before you can.
Yeah.
But we kids would get together. So, okay, what are you doing? Oh, all right. I'll be there Thursday. I'll check in. But that was, you know, we could do that because of the visual. And so the telehealth, I think that is great. So do you have tele-exercise things?
Not at this point. We're thinking it's generational. They're just really, they say, and even on the internet, trainers were going to that they just weren't making a living because people, sometimes you have to be motivate, and you actually have to touch the person, say, move this way when you do this.
Yeah.
And they go, well, I just go on YouTube and watch some guy do it. And you get this.
Yeah, I know, but there is still, this is something for another time, but there's still that communication issue. The visual helps, right? Because so I do quite a bit of coaching via Zoom, and I tell them they got to have the camera on. I've got 20, 25 people, and I tell them I got to have your camera on, because I don't know if I'm making any sense or not. I said something, and right here, right there, you and I have the same forehead. And so, we know by looking at them. And so that telehealth, I think, is so huge. All right. So what's the best way to get hold of you folks?
Yeah, I mean, I think we're in the age now of Google, right? And you can actually sit there and trust other people's reviews, right? So, I mean, I would Google pharmacy near me, or delivery pharmacy, or, easy food, individual servings, or any of that kind of stuff. And I think any of us would pop up in those kind of search engines. But you can also sit there and say, okay, there's a ton of 5-star reviews here. You can trust other people's opinions, or if you maybe don't, and there's 1,000 reviews and the overall ratings, above 4, it's probably a pretty good start. But I mean, that's the best way to go about doing so in general, right? So if you're not even around here locally, to just go find those resources. But here locally, I mean, you can search us, you can look us up, Mountain Care Pharmacy. I'm sure Beth has got a website. I've been there. It's amazing. And it just go on there and go find the things. I mean, I wish this was an easier process. I wish this was as simple as saying, like, they'll come find us, right?
Yeah.
And we try. I mean, we're doing this, we go to senior expos, we do a bunch of different marketing events and that kind of stuff. We try and get out into the community as much as possible, but nothing's perfect, right? We can't reach everybody that we possibly can. So if you guys are able to, and you're seeing this, go online, jump online, find those good resources, and kind of go from there.
And a lot of the resources will then give you their list of people that they like to work with.
Mhm.
Yeah.
You probably get a hold of one of us and we'd be able to start listing everybody who you'd want to talk to.
Yeah. And Mike, it isn't so much you they'll run into, but people you've trained.
Yes, but first, Central District Health, Fit and Fall Proof, my number will come right up.
Very good.
And we can get you, a place. Because we're so full, or we can, plus I have the health department behind me. If there's other questions, things go down a rabbit hole. There's tons of resources. I got these good people, I have my coworkers. So yeah, we can get you
Very good.
going.
And same thing.
Yeah, so we work really kind of behind the scenes. We work with a lot of providers' offices, hospital systems, and community-based organizations, and then also do direct education. But really, we are trying to inform all of those groups about how to best take care
Got it.
of this population for the
Very
best
good.
possible outcomes and to stay out of the hospital, independent at home.
Oh, by the way, in our office, Karen is a fit and fall proof trainer, just so you know. Very good. Very good. All right, we got 3 minutes. Oh, I was going to mention, Carly helped me, but they can get onto our website and you'll be able to pull up a video, not today. I don't know when. And be able to pull up that information. Aging in place, as it's actually Age in Place, Idaho. Aging in Place, Idaho.com. That has everything that we're doing here and all the people, so you'll be able to track that down. Whoa, we didn't get everything, but we got a lot of stuff done in an hour. Thank you. I don't know about you, but I'm exhausted.
I'm kind of hungry.
Yeah. So did you bring it? No.
Based it.
Oh, what an opportunity.
After I got here, I was like,
I brought some stuff.
when do you lose the brain?
Well, I know before age 6 thank you all so much for being here and sharing. This is huge information. We just do the best we can to get it out there. And so I appreciate your efforts as well. So thank you.
Thank you.
And thank you for all your guys are doing. This is amazing.
Yeah.
Amazing.
Well, good.